All right, this is section 5. So in this section, I'll be going over COVID-19 transmission and symptoms, including explaining why some people lose their sense of taste and smell. I also go over long-term effects from COVID, asymptomatic cases, and reinfection, and I will end by comparing COVID-19 and the flu. Okay, so how does this virus get into your body? So when you breathe, talk, or cough, you normally exhale little drops of water. So in an infected person, these drops can contain the virus. And most droplets hang out in the air and can be breathed in by someone else. So this is how the virus gets into another person's lungs. So if a droplet is heavy enough, it can fall to the ground or fall on objects like a table or a phone that can transmit the virus if someone touches the object and then touches their eyes, nose, or mouth. That's called fomite transmission. And it doesn't seem to be a common way that this virus is transmitted. So this virus is normally transmitted by breathing it in from the air. So anyway, once the virus gets into your body, the virus can infect nearby cells and then spread to other areas of the body after it multiplies in your cells. So this graph is showing a viral load. So that means how many viruses are in a person's system at one time. So see here, when a person is first exposed, that first virus or first couple viruses are breathed in, obviously you don't have many viruses, so you have a low viral load at this point. So as that virus copies itself, the viral load increases. And this happens before you have symptoms, and so this is called the incubation period. On average, it lasts around 4 to 5 days, but it can last up to 2 weeks in some people. So notice that a few days before symptoms start here, a person is infectious, so meaning they are breathing out the virus. They're breathing out water droplets that contain the virus, and those can infect other people. So this right here is called pre-symptomatic transmission. So transmission, a person is contagious before they have symptoms. So remember that symptoms only start once a person has had enough damaged cells to trigger that immune system to start fighting this virus off. So a person is most contagious when the viral loads are at their highest. So that's up here. And that's a few days before symptoms and the first few days of symptoms. So that's one reason why this virus is so tricky. It can be spread for a few days before a person even knows that they're sick. So that's why it's so important to wear a mask even if you feel fine. And I also go over masks in the next video. So as your immune system kills off the viruses one by one, eventually you don't have enough viruses in your system to be contagious anymore. And then hopefully you get over your symptoms soon. So this is a list of some common symptoms of COVID-19. Not everyone will have all of these. So for example, my parents both had similar mild symptoms, kind of like a cold, and my husband had a cough, and then he lost his sense of taste and smell for about a month. So why does it affect people so differently? One of the reasons is age and health conditions. They seem to be the biggest factors in how severe this disease is. So especially if someone has an underlying condition like COPD, additional lung damage from this virus may make it really hard on the person because they already have lung problems to begin with. Also, these symptoms depend on which cells are being infected. So if you watch the science videos, you know that this particular virus can infect any cell in your body that has that correct doorknob, that receptor. And with this virus, that receptor is the ACE2 receptor. And the number and location of these ACE2 receptors also depend on your health conditions and your individual genetics. So for example, since my parents didn't lose their taste and smell, but my husband did, my husband probably has lots of ACE2 receptors on cells in his taste buds and in his nose, and my parents probably don't have many there. So that's just one example of how people can be affected differently by this virus based on their genetics. So I want to quickly explain how you lose your sense of taste and smell because I think it's really interesting. So let's start with taste. This is a picture of your taste bud in your tongue. So normally these pink cells right here, called receptor cells, are the ones that actually sense different tastes. And there are these little nerves here inside your tongue that This pink receptor cell tells it what it tastes, and then these nerves conduct that information to the brain. And so these receptor cells, these pink cells, do not have the ACE2 receptors, which are those doorknobs that the coronavirus unlocks with its spike protein key to be able to infect your cells. So it can't infect these pink cells. But these receptor cells can't really take care of themselves, so they have babysitter cells or support cells that do take care of them. These purple support cells do have ACE2 receptors, so the virus infects and kills these purple cells. And then the receptor cells, they can't take care of themselves, so they die too. And so the receptor cells can't tell the nerves to tell the brain what they taste, and that is how you lose your sense of taste. And this is all happening in the tongue, so these cells do tend to grow back within a few weeks or months. And the way that the virus affects your sense of smell is really similar. So this is a picture of your nasal cavity. So this is kind of like the roof of your nose. So the nerves go straight up from here, up through your skull to your brain to tell your brain what it smells. And so this is actually the area that they swab during COVID tests, but there is skull in here, so they are not touching your brain. So these yellow receptor cells here normally sense odors in the air here, and then they communicate to your brain to tell your brain what they smell. But again, they can't take care of themselves, so they rely on these purple support cells to stay alive. And so these support cells do have ACE2 receptors. These receptor cells do not. And so the virus can get into these purple support cells or babysitter cells, and it kills them. And then these yellow receptor cells can't take care of themselves, so they die too. And then you can't smell anything. And these also grow back within a few weeks or months. Okay, let's talk a little bit about long-term effects of COVID. So if someone has lingering symptoms from COVID, like on the last slide, that's typically referred to as long COVID or long hauler COVID. But you could have some other long-term effects that are a little bit more serious. So some examples of those are heart inflammation, lung scarring, trouble breathing, and kidney damage. So remember, I'm going to say this a million times, this virus can infect any cell in the body with that ACE2 receptor. And so this receptor is normally involved in the RAAS pathway, if you want to look into that. This pathway regulates blood pressure, and this involves cells in the heart, lungs, and kidneys. So some cells in the heart, lungs, and kidneys are going to have this receptor for this normal function, which the virus takes advantage of. And that is why, you know, that virus can infect any cell with that receptor. So that is why this virus can cause organ damage that's not on the lungs that you typically, you know, wouldn't expect. So that is why those organs can be damaged. And that's what makes this virus so much more serious, I think. So there have also been strokes, blood clots, seizures, and Guillain-Barré syndrome, which is an autoimmune disorder. Also, you can have mental health disorders created just from the trauma of a person surviving a severe case of COVID-19, or maybe a loved one going through COVID-19. So also, I want to point out, not everyone experiences long-term effects, but if the case is severe enough, it can cause long-lasting damage. So this stuff does happen. It is possible. Okay, I know asymptomatic cases are pretty weird and confusing, so I want to talk about those now. So an asymptomatic infection is when a person is infected, so that means the virus is in their body and that person is contagious, but that person doesn't have any symptoms. So how can this happen? So one way that this can happen is the body isn't being damaged enough to cause an immune response. So maybe a person's ACE2 receptors are shaped slightly differently. Remember, that fit between the key and the receptor makes a big difference in if this virus can get into your cells or not. You know, maybe this person doesn't have many of those receptors, so the virus can infect a few cells, but it couldn't replicate like it normally could. So asymptomatic cases are sneaky because an asymptomatic person is just as contagious as a symptomatic person because they have just as many viruses in their body. But this person feels perfectly fine. So they go about life like normal, and they usually don't get tested unless they know that they've been in contact with someone with COVID. So because they normally aren't tested, we can't be exactly sure of the numbers, but asymptomatic cases are expected to be up to 40% of cases. Again, this is why it's so important to wear a mask and social distance even if you feel fine. And again, I go over masks and social distancing in the next video. Now I want to talk about reinfections because these are possible with COVID-19. It has happened in a few cases, so I just want to talk about that a little bit. So reinfection means that a person gets COVID twice, maybe because their immunity from the first case wasn't strong enough. So reinfections have occurred and they may be caused by a weak first immune response, especially in mild cases. So natural immunity lasts around 5 to 8 months, but it varies in the strength and the duration of the response in different people. Also, elderly people with comorbidities have the highest risk of reinfection. So again, a vaccine is going to prevent reinfection. So the last thing for this section, I want to explain why COVID is not the same thing as the flu. So first, let's look at the numbers. So this is a chart showing the annual flu deaths in the United States over the last several flu seasons. So 2019 to 2020 season, there were 22,000 people in the U.S. that died from the flu. And the year before that, 34,000, and the year before that, 61,000 people. So compare that to from January 21st of last year to January 17th of this year, 396,000 people have died from COVID. So that's just a very big difference in the numbers. Then you also do want to think about the contagiousness. So COVID-19 is more contagious naturally just because of how it infects cells, and especially whenever you consider the pre-symptomatic and asymptomatic transmission. So now think about symptoms. So the flu mainly affects your upper respiratory system. So that's not going to be, it's up here in your throat. It's not it doesn't interfere with your breathing most of the time. But COVID affects your lower respiratory system. So this is where your actual breathing occurs. It also may cause an overactive immune response, and like I talked about earlier, it can damage other organs like the heart and the kidneys, and so that may lead to organ damage or failure in those organs, especially in a person that already is having issues with one or multiple organs. And also, there's just this statistic here that hospitalized patients with COVID-19 had more than 5 times higher risk for in-hospital death and increased risk for 17 respiratory and non-respiratory complications than hospitalized patients with the flu. Okay, and so that is all on COVID-19 versus the flu. And so now the next section will cover how vaccines, masks, and social distancing work to stop the spread of disease.